Okay, a lot of people seem to think that mental health is black and white. So either we're feeling down all the time, or if we're great, then we're like that every day. But that's not true. Mental health is a spectrum, and we fluctuate up and down it throughout varying points in our lives. So you can be anywhere from healthy to stressed out a little bit, struggling, maybe in a crisis. And how we take care of ourselves depends on where we are on that spectrum. It's a lot like physical health. Physical health is also on a spectrum. You can be either a little bit sick or very sick, and how you take care of yourself can depend on what it is. For example, if you have a headache, you might take an Advil and drink some water, and it'll go away after some time. But if you had a more severe migraine that's lasted for several days, then you might want to go visit a doctor to get so that he can offer you more support. Mental illness is the same way. It's also on a spectrum. So you can be anywhere from having a severe mental illness to no diagnosable mental illness at all. And it's important to realize that someone who is severe might have more symptoms than someone who's like minimal, who has minimal symptoms, and that can impact their lives a little more. But together, these two spectrums form a dual spectrum, which gives a better representation of how our mental health fluctuates in our lives. But regardless of having a mental illness, anybody can experience a struggle, and anybody can have a crisis. Mental illnesses may cause someone to struggle more frequently with their mental health, but with proper diagnosis, treatment, and support, recovery is possible, and everybody can experience optimal health. So with the mental health, or with or without mental illness, it can sometimes be difficult to recognize if yourself or someone else you know is struggling. And mental distress can be recognized as a struggle when someone's feelings, thoughts, and behaviors start to become intense, long-lasting, and are having a big impact on their lives. This is a tool we can use when we're trying to assess the severity of the thoughts, feelings, and behaviors that we might be experiencing. So we have to ask ourselves, are they intense? So they aren't like your mild everyday fluctuations. They're getting stronger and more persistent, and they're more unusual than the regular ups and downs of life. Are they long-lasting? So they're consistent and have a lingering presence over weeks or months or even longer. Many professionals suggest that anything that's lasted over 2 weeks is a cause for concern. And lastly, we must consider, are they having a big impact? So are they beginning to cause negative consequences in one's life, possibly interfering with everyday function or everyday goals? So in addition to these thoughts, feelings, and behaviors that we ask ourselves, it's sometimes still difficult to recognize the struggles in yourself and others. So there are other signs you can look out for to gauge if someone might be struggling with their mental health. For example, someone struggling with their thoughts, they might express hopelessness or anger or despair, and they might say things like, what's the point? No one's going to care about me anyway, or I hate myself. Or they might start saying or hearing things that other people don't, or expressing ideas and thoughts that don't make sense. Other feelings that you might notice that are intense and long-lasting include anger, worthlessness, sadness, or distress. They might show loss of interest in things that used to be super important to them. They might feel numb. They might show very high or manic mood or mood swings, differences in behavior. Other behaviors that might impact their life is if you notice someone drop out of school or quit their extracurriculars, quit their job, they've started to become more reckless or anxious. Their eating and sleeping habits change. They're not taking care of their personal hygiene. You might even notice that they have an increased use of drugs and alcohol, show anxious, repetitive behaviors, or self-harming behaviors. So those are signs that someone might be struggling with their mental health. Not necessarily signs of a mental illness. Either way, person showing any of those signs will need support and outside help in order to feel better. If you notice signs of distressed thoughts, feelings, and behaviors, remember to consider if they're intense, long-lasting, or having a big impact on their lives. If you think someone might be struggling for either or yourself, it's important to say something to them. And we'll talk later about how you can say something. So we've described the difference between everyday fluctuations and more serious struggles, but how do we know it's a crisis that requires immediate action? So what we just discussed are signs when someone might need outside help. A crisis is when these symptoms become so severe that someone is at risk of harming themselves or others. So an example might be like threats of violence to themselves or other people. Or if you perceive that someone might be going through a mental health crisis, it's important to get them help immediately. And it's no longer the time where you can sit down and have a conversation with them, encourage them to seek resources. You have to call emergency. So you either call 911 or another emergency service and get them connected like at that moment. So the takeaway message from this is mental health and mental illnesses are both along a spectrum. And regardless of having a severe mental illness or not, anyone can end up in a struggle or a crisis. You don't need to have a mental illness to fall into a crisis. A mental health problem may be considered a struggle when changes in one's thoughts, feelings, and behaviors start becoming intense or long-lasting or having a big impact on their lives. A mental health problem may be considered a crisis if there's a risk of harm to themselves or to others, and community resources should be sought whenever someone is struggling. Emergency services are necessary and vital if someone is in a crisis.